Josh Smart here. So this video, I wanted to do a follow-up video on my previous video on the shoulder surgery and my AC separation, grade 5. If you didn't see that video, you might want to go back and look at it. Okay, so I made that video just before I was going in for another surgery that was called the Mumford. They go in and they clean up and they shave down some more of your clavicle. I was feeling that, like I said in the previous video, that there was a lot of grinding and impingement going on. There were some bone spurs that they could go and remove, which was possibly causing me some of that impingement. So I went ahead with the operation. Pretty simple. You know, he told me that it was 2 to 3 week recovery process because they were just going in laparoscopically just to clean it up, and then they were going to sew back up and good to go. They weren't touching anything with the rotator cuff. They were just dealing with the clavicle and the bone spur. Surgery went okay. At about 2 weeks, I went in for my follow-up, and I think I was okay. I mean, I was recovering. I followed the doctor's orders. I still was feeling a little bit of like scar tissue, I guess. So stupid me was rubbing it a lot. I think I even tried like a massage gun in the lower part of my delt. I do not recommend that because shortly after that, I started having bruising, but it wasn't from the gun. I believe it's the bursa sac inside your shoulder that was filling up. You know, pushing on it is only going to cause more inflammation in that bursa sac to possibly fill. So I went back to the doctor. He said, well, let me see if I can drain it. He put a needle down into the shoulder to try to see if he could, you know, express any of the fluid, and just straight blood was coming out. So he took out, I think, like a cc of blood. Nothing crazy, but he said, you know what, I don't think this is gonna work. Puts it out, puts a Band-Aid on it, sends me home. By the time I got home, it's about a 20-minute drive for me. My whole shirt was covered, but there wasn't anything they can do. For the next few weeks, I was getting bruising from that bursa sac and the blood that was underneath the skin, and it just started filling up and it started draining down my arm. I'm gonna post some pictures and some updates. It just kept getting worse from 1 week to week 4 after that. It was bad. It looked like you had just taken a baseball bat to my shoulder. It hurt, but it looked a lot more gruesome than it was. Now, this was right before the COVID shutdown. So like I was excited to get back into the gym, and then all of a sudden everything stopped. So that was tough for me because I still had some weights at home in a little gym, but I was wanting to go back, you know, to a big gym with all the access of all the equipment and weights, but that couldn't happen. My hope with this video is to help any one of you that are dealing with some similar situations, contemplating should you get surgery, because let's face it, some of these doctors, you know, they're really just covering their butt because, like they said before, there's so many different types of operations. I believe there's like 30 different ones they could do for an AC separation, and not one has proved sufficient or as like the top winner. They don't like to do it because they know what the outcome could be, okay? So for me, I think after the year mark after my first AC separation surgery, I think that it kind of as I started using it, you can start pulling that ligament again. Remember, they used a cadaver ligament for me. Now, I had this question just on recently on this video, or my previous video. Is there a benefit of waiting, like the doctor told me to wait 12 weeks? There is not a benefit. In fact, if you need surgery, then you should be getting surgery as soon as you can, because the ligament that is torn, they can probably just repair that ligament. But if you wait too long, that ligament just dies and they can't use it. So they have to use another ligament, a cadaver ligament or a pig ligament, to do that reattachment. But there's nothing else as strong as your own ligament. So the doctor that did my surgery said, I wish you would have come in sooner. We could have used your current ligament that was torn. So if you know you need surgery, then I would try to get it as soon as possible. But here's the big but. If you have a grade 2 or 3, I would really think strongly about not getting the surgery. Simply because you might just be left a year later with exactly the same issues, okay? So what have I learned dealing with this? Because that revision surgery was 2.5 years ago at least. Now, I still feel some of the same things, right? You can still see when I move across my shoulder that there's definitely some impingement. I mean, you can really see it, right? This side doesn't do it. This side does it, but I don't have the popping that I used to get, simply because I think just over time and exercises and things that I do, to create more space in the shoulder helps with that. So one thing I don't like to do, I don't do decline bench for sure. Anything that pushes your arms down. Incline's great because if you keep your shoulders back, the AC joint you want it to pull back towards, your rear delt. There's more space. If it comes forward, it's just gonna feel like it's hitting your neck. Okay, so if you're lifting or anything, just keep your shoulders back, will create more space with that AC joint. Also, I still do a lot of rotator cuff warm up and exercises just to create that healthy movement and space going. So you might have to sort of chip away, so to speak, at what's in the shoulder and create more space for wherever that AC joint is sort of flowing or flopping around in there. Because remember, the ligament that was torn was keeping that in alignment. But now it's not, it can move. It will resettle in a new position. So, one thing that I suggest if you have a grade 2 or 3 and, there's some pain, you kind of want to get back to your activities, KT tape was a big help for me because even after the revision surgery and before, I would put a piece of KT tape here and here just to hold the collarbone or AC joint down so it didn't move for me. So that helped for a little bit, but there are some things that you can do to keep moving forward in your progression. Definitely do your research. If you need to go to 3, 4 doctors, make sure the doctors are listening to you describe how it feels, and then ask them as many questions as you can. If you've had a grade 5 separation and you have some clicking or popping but no pain, I don't think I would recommend looking into the revision surgery, okay? Hopefully the doctor did his job, shaved down enough, but I still think I was getting some of that same impingement after the revision surgery, so I'm not really sure if I'd go back to it, especially since I was dealing with that hematoma in my shoulder. If you've had this surgery, I'm sorry, it sucks. I'm with you on there. But I believe there's still hope at the end. Any activities that I need to, I'm not limited. I don't do certain exercises because I know it's not great for my shoulder, but listen, it's an accident and injury that happens. We have to move on with it, but there's still light at the end of the tunnel. I know it's tough, but just keep going. If you have any other questions, let me know. I hope I can answer some of them or all of them for you. I hope this video helps you out, and hopefully you're on your way to recovery. Thanks for watching, and if you have any questions, let me know. Don't forget to hit that subscribe button, and I'll see you around. Stay tuned for more.